I'm Jeff Cook. I'm the CEO of Noom. And what brought me to health is, this is the place to be if you're in healthcare. It really is. There's nowhere else where it seems like everyone in healthcare that matters is here. And just sitting at the booth just made some high class connections that I don't think I could have made any other way. My first time coming to health was last year when I first came into the role. And I don't think I've ever been to a better conference. And of course, I came back this year. So we have a major activation here at Health, and some of the value that I think we get out of it is the connections with employers, with health plans. We had a great dinner with the team last night, and so I think that's sort of where you could have like a chief technology officer and chief medical officer of a plan, kind of mingling with folks in technology companies. It's just a fantastic venue. So Noom is very much selling into employers, its programs, and has been. Noom is known as a consumer brand. We have recently come out, and actually what we announced at Health is 2 new products to help ensure affordable access to GLP-1s for a workforce. And we really look at employers and health plans in 2 ways, right? There are those that want to cover GLP-1 medications despite their high price. They want to solve it, they want to figure it out. And then there are those who are just sitting on the sidelines at the moment, waiting for the prices to come down. And we want to meet them where they are too, and it's the much larger cohort at the moment. And so what we announced is essentially the first solution is to have a supplemental benefit, a carve out of the GLP-1, where you could have a lower or a higher copay for the employer or for the employee to access the GLP-1. And what's great about the program is we combine Waltz Health's pharmacy network that gets the medication to the door quickly with the Noom behavior change program and with a risk triaged clinical protocol that drives ROI for employers and payers. And so, it's a great program. There's really nothing like it. And then to address the many employers and payers who don't want to cover yet the GLP-1, we bring our healthy weight, comprehensive obesity suite of solutions into a workforce, but we pair that, and this is the unique new bit, we pair that with access to the Noom GLP-1 RX compounded semaglutide, the non-branded semaglutide product. And so employers cover Noom, but the employee can pay up for a heavily discounted access to an already affordable choice of medication. I think everybody is here at Health, and that's what makes it such a fantastic venue. And what I see is just high-class programming, like very, very fantastic sessions with really thought leaders in the space. But I guess from my perspective, what's even more valuable is all the one-on-one meetings that I kind of set up ahead of time, but also even the impromptu connections. I had just 2 today that, one, somebody from India, I would not have expected to have seen him, and another was a partnership that may well rekindle. And so these are things that I think only happen at Health. If I had to describe Health in a single phrase, I guess I would have to say you must go there each year, right? It really is you have to be here. If you're not, you're kind of missing out on the conversations your competitors are having.